Sehr geehrte Damen und Herren, Gavi, die globale Allianz für Impfstoffe und Immunisierung, kämpft seit vielen Jahren dafür, dass auch die ärmsten Kinder der Welt grundlegende Impfungen erhalten. Das ist ein Segen für Millionen von Kindern und ihren Familien. Und es ist ein entscheidender Beitrag zur globalen Gesundheit. Daher freue ich mich auch heute noch über den Erfolg der Geberkonferenz vor 3 Jahren in Berlin. Die Weltgemeinschaft hatte damals 9,2 Milliarden US-Dollar für Gavi zugesagt. Seitdem konnte die Impfallianz ihr Engagement weiter ausbauen. Sie sorgt für Aufklärung, für bezahlbare Impfstoffe und ihre Verbreitung, für die Stärkung von Gesundheitssystemen und Bekämpfung von Epidemien. Bei allem Einsatz müssen wir aber auch feststellen, dass noch viel Arbeit vor uns liegt, um tatsächlich allen Kindern weltweit notwendige Impfungen zu ermöglichen. Denn ob ein Kind geimpft wird oder nicht, ist nicht selten eine Frage über Leben und Tod. Wir müssen alle Kräfte bündeln, Regierungen und private Geber, Privatwirtschaft und Zivilgesellschaft. Nur gemeinsam gelingt es uns, allen Kindern die Chance auf ein gesundes Leben zu geben. So wie es uns auch nur gemeinsam gelingt, die Ziele der Agenda 2030 zu erreichen. Gesundheit ist gleichermaßen Voraussetzung für und Ergebnis von nachhaltiger Entwicklung. Deshalb bin ich froh, dass vor kurzem beim Weltgesundheitsgipfel in Berlin ein Entwurf des globalen Aktionsplans für ein gesundes Leben vorgestellt werden konnte. Der Aktionsplan wird unsere gemeinsamen Anstrengungen leiten. Denn was könnte es Wertvolleres geben, als millionenfach Leben zu schützen und millionenfaches Leid zu vermeiden? Gemeinsam können wir das, wir müssen es nur wollen. Daher danke ich von Herzen allen, die sich insbesondere für die Gesundheit von Kindern und ihren Impfschutz einsetzen. Mein besonderer Dank gilt den Gastgebern dieser Konferenz, Scheich Khalifa bin Zayed Al Nahyan und der Regierung der Vereinigten Arabischen Emirate. Ich wünsche ertragreiche Diskussionen, gute Ideen und den Erfolg, den wir für die Kinder dieser Welt und für die globale Gesundheit brauchen.
Thanks and gratitude to the Chancellor for her kind and informative message. Country ownership and involvement is one of the cornerstones of the Gavi model. In this star-studded panel discussion with heads of state and government from Gavi countries will shed light on the impact of scaling immunization in their countries, key challenges in establishing a strong immunization process, and what is needed to accelerate and secure results in the future. Please welcome to the stage Her Excellency Reem Hashimy, Minister of State for International Cooperation in the UAE. His Excellency Mahamadou Issoufou, President of Niger. His Excellency Carlos Agostinho do Rosário, Prime Minister of Mozambique. And finally, Dr. Ngozi Okonjo-Iweala, Chair of the Gavi Board. This session will be moderated by Zain Verjee, founder and CEO of Zain Verjee Group.
Thank you so much. Welcome to this session. It's really the political leadership that is so key to the success of Gavi's work on immunization and building those strong health systems for future generations. I just want to take a moment to give you 2 examples that have stood out. Thanks to the strong leadership of the government of India, there has been a significant increase in immunized children. New vaccines have been introduced. Thanks to the catalytic impact of Gavi-funded programs in India, domestic financing for immunization has more than tripled in the last year to over $270 million. Political commitment is even more critical when a country goes through devolution, like in my own country, Kenya. This major transition led to some confusion about the roles and the responsibilities between the federal level and the state level. For example, around things like budgets, the commitment of governors, and the prioritization of health and immunization. So I want us to spend a little bit of time on political leadership and speak to some of the success stories that we have on the panel here, and really talk to the leaders here who have shown such strong commitment to immunization and to health. Thank you so much for being with us. Excellency, I'd like to start with you and your perspective that you can share with us on the UAE, because the UAE has had such remarkable achievements in health. For example, infant mortality rates have halved over the last 25 years, and the UAE also has the lowest rate of maternal deaths in the region, and one of the lowest in the world. So what were the main drivers of this success?
Thank you, Zain, and thank you, Your Excellencies. It's an honor to be able to share a panel with you and to all of our audience here today as well. Thank you for being with us. When objectives are very clearly set out from the beginning, it's a lot easier to achieve them. And when our nation in the UAE was formed in 1971, there was a very clear commitment to making sure that the overall well-being of the citizen would be prioritized above all else. And so the statistics that you mentioned certainly fall under that category. But more importantly, the ethos of the Emirates is about trying to make sure that others in our region and beyond our region also enjoy and benefit these types of socio-macroeconomic indicators. And so we've been very committed to making sure that our immediate hinterland also sees some of this type of progress, and we have been working very closely not only with the African continent and the Indian subcontinent, but also as far away, I would say, as the Pacific and the Caribbean small island developing states. And the power, if I were to be able to use that word, of what the UAE has been able to do is that it is a massive convener. And perhaps this Gavi MTR session happening here in Abu Dhabi is a testament to that, bringing people together from all over to be able to share experiences, but not for the purpose of only sharing, but for the purpose of encouraging and determining progress forward and improvement forward. And so our humble experience has been something that we've been very proud of, but did not want to keep within our borders, and wanted to very much dedicate our effort and our attention on ensuring that that type of work also spreads beyond our direct perimeter.
Thank you. Excellency Mahamadou Issoufou, I'd like you to talk a little bit about the difficult security situation that Niger faces, and how do you really reconcile the need to prioritize health as well as balance the important security challenges that you have in Niger?
Bien, je vous remercie, Madame. Je voudrais commencer d'abord par remercier Son Altesse Mohammed bin Zayed,
His Highness Mohammed bin Zayed, who is hosting this event and has welcomed us so warmly here, and Gavi for having invited us. You have underlined that the Niger is facing a lot of challenges indeed, demographic challenges, climate challenges, and security challenges. And all these challenges, unfortunately, keep increasing day by day and require extra healthcare, especially when it comes to our security challenges. We have a lot of terrorist threats at the borders, and the borders with Libya, but also with Mali and Burkina Faso, Libya, and all the countries on the basin. But this security threat, unfortunately, requires us to allocate important resources to ensure security, and it can happen that some years we require to invest 20% of our budget in security. Although a part of this budget could have been useful to be allocated in the healthcare industry, in the healthcare sector. But the security threat have unfortunately provoked a flux of displaced people and refugees, men, women, children, who have lost everything and who are unfortunately in a situation of clear vulnerability that has affected their health, and they require our support in order to face their daily challenges. So our situation is complicated in Niger, and that's a fact, and which unfortunately unfolds to the demand of health that is unfortunately less than what we can offer. But we do insist and we do invest a lot in this sector, which is part of our 8 priorities of the replenishment program that we have put in Niger since 8 years, 8 ongoing years. And our main objective is to invest 10% of our budget resources in the health sector. It goes without saying that these are national resources that we are allocating, but to that we have the contributions from our partners that are added to it. And the contributions, our partner contributions, are feeding a common fund, which is a financial tool of the health ministry in Niger. And within this common fund, there is a strong contribution that comes from Gavi. And that said, I would like to thank Gavi wholeheartedly for this incredible contribution and the support that they have provided to Niger. And I would like to congratulate Gavi. Let me take this opportunity, because since the creation of Gavi, Gavi has managed to vaccinate 700 million people, and you have saved over 10 million lives. So congratulations once again, Gavi, for this incredible achievement.
Monsieur le Président, I'm interested to know, how do you personally navigate turbulent internal politics so you can prioritize the health agenda? How do you stay focused, and what lessons can other leaders of nations take from what Niger is doing, given that the security threats exist in different ways in different countries? But how do you stay focused?
We stay focused this way. I always said that health was a priority in Niger, and the replenishment and the rebirth program in Niger considers that the human capital is the most precious capital in the country. We need to develop it, we need to reinforce it through education, through training, vocational programs, but also through health coverage systems, because investing in the health is investing in economy. Investing in vaccination is creating the right conditions so that our people maintain great health and they can be therefore productive and competitive. I was saying that within the Gavi framework program, 2016-2020, the objective is that we have allocated $80 to $100 billion. The return on investment was $80 to $100 million thanks to the vaccinations in the world. Now, we cannot develop a country without its people and without a healthy population. Since we have a very young population, you must know that 75% of the Nigerians are under 25. We therefore have a very serious demographic asset that we need to transform in an economic dividend. And the best way to do it is to invest in health and, of course, in education and vocational training.
And to Excellency Carlos Agostinho da Rosario of Mozambique, Mozambique has really achieved the Millennium Development Goals for child and infant mortality ahead of time, and is committed at the highest levels to achieving the Sustainable Development Goals. Can you tell us what has been so key in Mozambique for making this happen, especially in a low-income country?
Muito bom dia a todos.
Good morning to everybody. Good morning to all my colleagues from here, from this panel. And we have here we wanted to achieve the goals of the SDGs, and one of the main factors that we have used is the factors of leadership, or the political will. We have a President of the Republic. He is a champion in this area. What he has done was he has taken care of the human factor. He is an expert, and he has done everything so that everybody has access to the health care. And since the very beginning, he has done that. And he has taken care of that, and he made a priority the immunization system. And so 90% of the population has been vaccinated. We have some regions that are located far away that have a difficult structure that we couldn't reach yet, but we have achieved a lot so far. And so we have used the immunization. So we have a robust economy. And we have about 10% that we use for the healthcare system. We have given a lot of attention to the basic care of the health system, and this has contributed a lot to reach the levels that we have achieved. Other factor would be, the partnership with Gavi, it has been spectacular in Mozambique. So actually, since 9 years ago, we have been having a partnership with Gavi, and this has brought to us excellent results. And we have, in this way, achieved very good results. So our priority is the healthcare system, but we have also programs for agriculture. So the healthcare alone cannot work. It has to be associated with other sectors, and we have associated mainly with agriculture. And this has contributed also to the progress in the country. This is our way that we have worked, and for each. No, in the past, for 1,000 children that were born, 97 were dead, and then now we have reached a better goal, and we continue improving. Actually, we are happy about our results, but we want to achieve even more. And then we are working in partnership with agriculture. Thank you very much.
Can you give me an example of what you're most proud of? What was challenging for Mozambique? Can you give me an example of what was most challenging for Mozambique that you were able to overcome successfully, that move you further toward reaching these goals? Just share something personal with us from your perspective.
Mozambique crossed some difficult problems, the pacification moment in the country. We want our population, and the war wouldn't bring good aspects for health and create a big impact. And it ended the war, and this was a decisive factor for the things to be able to go. Without the war, it was easy to distribute the medication. Without the war, it was a lot easier to immunize children in the rural areas. So the most challenging was to distribute the medication. We had an inflation controlled, and with the presence of Gavi, we're supposedly to have a lot of increase. And in this moment, that's it.
Dr. Ngozi, can we talk a little bit from the finance minister's point of view and just kind of take a 10,000-foot view here right? Let's talk about infrastructure, in its essence, and how important is it for finance ministers to look at infrastructure overall and budgets in order to deliver the kind of health systems and basic needs such as electricity, for example, or cold chain supplies, cold chains to operate successfully through the countries that where Gavi operates.
Thank you, Zain, and I must also say how wonderful it is to be here with two politically committed leaders and a wonderful audience. So thanks again to my sister, Minister Reem, and the UAE government. This question really allows me to take off from where His Excellency, the Prime Minister of Mozambique, left off. Because he said something very important, that health alone cannot do it, and we should not forget to look at other sectors. So, vaccinations, immunization programs are essential as the basic building block. So what we are trying to achieve in Gavi is very important. But we also, in the context of the SDGs, and must link it to other sectors. And so when finance ministers look at the budget and they think of health, they don't think just of the health line and the health budget. So you talk to many of them and they often get agitated because, as building on what was said yesterday, sometimes health ministers may say that the health budget is not as big. But when you finance water, for instance, you're also contributing to health. Because in some cases, some of the diseases that our children are confronted with come just from absence of sanitation and water, diarrheal diseases, and you can probably save more lives through that. So that's infrastructure. You mentioned energy, electricity. On our continent in Africa, the majority of people don't yet have access to electricity. But we have to deal with vaccines and the cold chain. How do we maintain, the integrity of the vaccine in the absence of electricity and the cold chain? So we saw many innovations yesterday designed to address that. But if a finance minister can also put more money towards electrifying the country, that's also part of the healthcare system. So I just want to say that looking at it from that perspective, you need to be a little bit more broad-minded and more cross-sectoral when you're thinking of health and the health budget.
So if I'm a Minister of Health and I come to you, or Ministers of Finance, how do I browbeat you, or how do I convince you to allocate that portion of the budget to me and the health priorities? Like, what is the strongest way for me to make my case?
I think, Zain, as we said yesterday, the strongest way is through talking about the value for money and the rate of return on the health investments. But particularly, as we saw yesterday and have repeated, that the rate of return to vaccination, to immunization programs is so high. And we quoted all the numbers. I think Seth repeated some of the numbers. So that's the first point. And then you can, of course, add the humanitarian aspect. But what I would advise is you probably should not fight. If the minister also says, look, I'm going to give additional money to the Minister of Water Resources, I think you should go to the Minister of Water Resources to have a dialogue to make sure that that is not going to only to some kind of prestige projects, but it's actually trying to serve the populations that don't have water in the rural areas, in the urban slums, and so on.
Excellency, you mentioned earlier the importance of being collaborative and all the different players that the UAE engages around the world. Could you speak a little bit more to that? And that particularly is the core of the Gavi model, the unique kind of partnerships that come to the forefront.
I've been smiling as my sister Ngozi spoke about the ministries of finance, and I wish our Minister of State of Finance was here to hear about how we could try to convince him for more budgetary allowances, and they're always very good at looking at the rate of return. So I think broadening that component is essential. But on a more serious note, we like to, so humans, I think, in general, like to categorize things in boxes, but life and issues and challenges that we deal with are not in nice, neat little boxes. They're all interconnected, and this really builds on what everybody actually here was saying. And so as we look at our desire and commitment to build partnerships, we need to also make sure that these partnerships are holistic partnerships, are full-fledged partnerships that are really properly woven in several aspects, because everything is very much interconnected. Not only does the UAE sit in a geographic strategic positioning that has access to the beautiful continent of Africa, but also to an emerging part of the world, we're also very well logistically connected. And so many of the audience members that I've had the honor of saying hello to here today are stopping in the UAE on their way to somewhere else. And there's a statistic here in the Emirates that every 90 seconds, a plane either takes off or a plane lands. And so that gives you a sense of how connected we are. Now, that could be purely a logistical advantage, but it could also, and it is also, much bigger than that. It is about bringing people together, and it is about sharing these ideas, and again, not for the sake of sharing them alone, but sharing them so that we can ultimately progress further and better together. And as I had noted earlier on the importance of this Gavi MTR session in Abu Dhabi, it speaks to our commitment to helping to improve the state of the world that we live in, either by endorsing SDGs as a general UN multilateral framework, or by strengthening the bilateral relations we have with countries such as Mozambique, Niger, and others. Or it's also ensuring that our own domestic agenda continues to be relevant to what is also happening around us, so that we're not myopic on the challenges as well. So partnership and collaboration, I believe, very strongly sit at the heart of development. And the most powerful thing about that is to be able to do it well, you need to be able to do it with everybody, and you need to be able to do it collectively. It's harder. Sometimes it's easier to just go at things alone, but you definitely won't get the optimal results that you deserve and that you want.
Mr. President, building on that, in Niger, what kind of partnerships have you pursued? What kind of collaborative efforts have you pursued to build stronger health systems in the very challenging context that you face?
Thank you very much for your question. I would like to come back to what the Prime Minister of Mozambique has just said with regards to the health issue that has to be considered within a global perspective and ensure that it is within a holistic program for each country. And it's exactly what we have tried to do in Niger with the Renaissance program that holds 8 priorities, and these 8 priorities all are linked with the healthcare sector. We have a very ambitious program that we call the 3N initiatives. The Nigerians feed the Nigerians, and it is also the healthcare sector and the education sector, because the more you are educated and the more you can take care of your own health. And it is also the fact of water access for the population. So now we work within a global perspective while remaining conscious that a lot of sectors influence, in a way or another, the healthcare sector. Now, to answer your question, Niger has recorded great progress in terms of vaccination penetration. We have recorded a reduction of fatalities and child mortalities, especially through the partnership with Gavi and other partnerships. For instance, you know, with the measles, in 2004, we have recorded in Niger 60,000 cases of measles, And today, only 1,000 cases, or 1,500. Imagine the progress we have achieved. But despite all these efforts, Niger remains a country that is unfortunately facing a high outbreak risk with rubella, meningitis, and we have reflected with our partners and shared experience and tried to gain some lessons learned. And the lessons learned would be to actually highlight and concentrate more on health prevention, and we need to act faster. In our relationship with Gavi, who was our first financial partner within this sector and a technical partner, we have decided to focus on 3 important points. The first one would have been to reinforce the surveillance system, the monitoring system. Number 2 was to do everything possible to bring back the information gained from the sites in order to improve our statistics, because if we can prevent, in order to prevent, we need to have the numbers and know who is on the ground. And thirdly, what has motivated us is that all the vaccination campaigns are very costly, very expensive, and time-consuming. So what we have done today with Gavi is try to find how we can develop the routine vaccination systems and change our campaign focus. We have been working with this, and we are extremely satisfied with all our partnerships developed with Gavi and others. Thank you.
Can you give us an example of how you were able to build a strong health system or have a success story in all the initiatives that you've been facing, given your difficult environment? Just give us an example that we can learn from.
Like I mentioned, what we are currently doing is that we are opening up the coverage, the vaccination and immunization coverage in the country. The example that I tried to give you was measles. The example for measles. What we have done to fight measles is an excellent example. How we have managed to push it back in 14 years. From 2004 to today, we went from 60,000 cases per year 14 years ago to only 1,500 cases today. Now, what happened for measles is also the same for cholera, but is also good for polio. I mean, Niger is not a country where polio outbreak is important, but we do have a neighboring country where, unfortunately, the polio disease is strongly present, and I believe it is still there in 3 countries in the world: Nigeria, one of our major neighbors with whom we share 1,500 kilometers of borders, Pakistan. I mean, we work also very strongly and closely to really eradicate this disease. This is one example of a success story in Niger. But let us not forget the other diseases. I do believe that in Niger, there is one group that we are covering. I'm looking right now, the Minister of Health, who is here, is that we have 12 to 14 vaccinations that we're currently putting in place in order to protect our children with extraordinary results. We have managed to reduce the child mortality to 198. We used to be at 198 per thousand. Today we are 90 per thousand. It is still a high number, but we are still fighting it.
Thank you. Mr. Prime Minister, how is Mozambique using innovative ideas to advance health? Give us an idea of what you're doing in that innovation space.
Yes, but first of all, I have to agree with the panelists my colleagues here, the Minister of Finance. In our country, we have a very interesting experience. The access to finance is not a very big problem to ask. Problem is about prioritization. Our government prioritized health as the main sector. We want to have a healthy population, and we defined priorities. So in our country, we have 66% of our budget for health, education, water, so there's not a problem. So we have the partnership with Gavi, which is very good, and we have a lot of examples on how the innovation can be very, very useful for the distribution of and control of the stocks, the immunization, and we think that the innovation can be very useful with this stocks of verification and the place that we have to intervene rapidly. So we think it's very good for that. And also think that we have to work together with Gavi for the future. And this situation, this research situation, and last night we had a dinner and we could see the India experience, and India is doing the researches, and why not? Why Africa can't have a research center? So we also could have a population that is capacitated and graduated into producing vaccination. We need this immunization cheaper, and we think that this innovation can also bring advantages for the formation of our people who could do research in Mozambique and in all Africa. And this is what we're doing.
What would you like to pursue more of in the innovation space? What is the most exciting thing Mozambique is focusing more on in terms of innovation?
In the area of innovation, we want more emphasis in the formation of our people to be capable to do the research, that in the future we're capable to produce internally the vaccinations, and it's cheaper for our population. And we also emphasize that in our country could have innovation, could be able to predict what happens in determined areas, so we don't spend too much time, we don't waste time with innovation. We would like to have the innovation to facilitate all the process of distribution of immunization of the vaccines until they reach the locales where is necessary. We need innovation for all this health system, that it's a much more flexible and stronger system and much more operative.
Thank you. Dr. Ngozi, what do you see as the most critical role of the Gavi Alliance going forward?
Thank you, Zain. I think the most critical role really came up this morning also when we had this presentation from Hans Rosling on looking at the facts. Gavi has been successful in immunizing our children at scale, and that job is not complete. Seth also mentioned that in his presentation. So I see a critical role first as staying the course and completing the work that we do well to reach those children that have not been reached. We saw a map of the world, people in remote areas, as well as those in urban slums. So that's number one. The second role I think is critical for the Alliance is to continue to use financial innovation to keep the cost of vaccines low for our children. With the advanced market mechanism, Gavi has been able to negotiate the cost of vaccines down so that today it costs about $1,100 for a child in, let's say, the US or a developed country to have the full course of vaccines. We brought that cost down to $28. Can you see the vast difference? So continuing to use that instrument of market shaping to bring the cost down of new vaccines will be very important. The third role, and there are three I see for Gavi, is to be flexible. I think we've talked a lot about it here. Minister Reem talked about it, flexibility, innovativeness, to be able to adapt to the changing environment. So if we see, for instance, that vulnerable children have moved, there's no more sharp divide between between poor countries or developed and developing, as was shown. And now everybody is sort of in a hump. Do we continue our mandate and say that once you're below a certain above a certain per capita income, we no longer deal with you, even if you have vulnerable children? We need to rethink that, to say how do we adapt to reach those who cannot be reached, even if they're in middle-income countries. So being able to see what's changing, adapting to that change, being flexible, I think is the third mission.
Thank you. I'd like to ask all the panelists one final question, the same one for everyone, which is simply, when you look at unlocking our children's potential, which is what the core of this discussion is really all about, what is it that you think the most important thing is that you would like to impart to the audience in the room as the takeaway before lunch? Excellency.
You're letting me go first. Perhaps the strongest message is to get people to care about these issues. I alluded to this earlier. There's so many things that continuously happen that revolve around our list of priorities and list of to-dos, that to bring a sense of urgency and bring a sense of attention and then a full delivery of that particular piece is really how we achieve progress at the very end. We don't want butterflies that go from topic to topic without fully addressing them wholly. And we certainly don't want to have a situation where... So if I switch gears for a second, I'll say that I also do a lot of work in education. The challenge is sometimes you have schools and you have children in schools and you have teachers who are teaching in schools, but nobody cares to learn. Teacher doesn't care to teach and the children don't care anymore about wanting to learn. And so the sense of apathy is actually a very dangerous potential sentiment. Well, maybe not even potential, it's there. That people don't feel the urgency of wanting to be better, wanting to do more. My plea to my own family, to my own teams, and certainly to the audience here as well, is to continue to believe in how important this is to be able to have a better future for all of those that we love and all of those that we care about. And that emotion and that passion should not be in one conference room in one city. We need to figure out a way to carry that with us and take it to every speech we make and every interaction we have, so that we become true advocates of change and true change makers at the very heart that believe very strongly in not only the importance of these matters, but also in the urgency that they deserve.
Prime Minister?
I'm going to be brief. For us in Mozambique, the children are the flowers in commotion. It's the future of tomorrow. If we want a strong society, a healthy growth, we have to protect the kids. So we have to continue to do the immunization and to produce vaccines. And for that, we have a partnership which is Gavi. And the team that's winning, we don't change. So we're considering this, let's reinforce these partnerships so together we can have more immunization for our children. And let's concentrate more in those vaccines that are needed to avoid more deaths. In Africa, what kills more is malaria. And we know that there's some work on it. Let's concentrate to deliver immunization against malaria and give life to our kids. I can also say that Gavi is an important partnership, and we're going to reinforce the partnership. Let's get more committed and get more vaccines. And thank you very much.
Mr. President.
Bien, merci. Je voudrais dire que...
Thank you. I can say that immunization is indeed a big success in public health. And this success must be credited to Gavi. In the world of today, all children, regardless where they live, must have access to vaccines. We must carry on with this approach. We need to encourage Gavi to continue this noble mission. There are some points we need to continue to act. Firstly, the co-funding. All countries who benefit from Gavi actions must contribute to co-funding. I've noted that for the period 2015-2020, the objective was that these countries contribute by 100% to the co-funding, and this goal has been achieved, and we need to continue this process. The other point, my sister has alluded to it, it's about the reduction of the price of vaccines. Businesses making vaccines must continue to seek a reduction of vaccines. Even if vaccines are if they are too expensive, they are not affordable for those with low income. So this effort of reducing price has to carry on so that vaccines can be available to all. And lastly, there is another important aspect, namely research, to come up with the new vaccines. This was mentioned earlier. I'm talking here about research about therapeutic vaccines to cure some pathologies for which we do not have the means to cure these diseases. So there are many efforts that are still needed, and all actors have to contribute. This applies to states, civil society, and the private sector. And thus, we can implement the new phase that awaits us, because we have the 2021-2025 strategy, and we are in the period of replenishment of funds of Gavi, and Niger contributes to this effort. Thank you so much.
Final word.
Well, Zain, I'd like to say maybe two contrasting things. The first is that I would like the world, because literally we've got so many people in this partnership and this alliance, to celebrate the ability to have solved a problem. In the midst of all the uncertainties and the pessimism, we should not lose sight, as Bill Gates often says, of the fact that we brought a solution to a very important problem. Hanging on to that thought, I would also like everyone to feel uncomfortable. The fact that my child is vaccinated should not make me feel comfortable or complacent when I know that there's a child somewhere else who hasn't been vaccinated. Vaccination is a global public good, and we should all own it and support it. So don't feel comfortable when you know there's some child out there, because whatever it is that they've not been vaccinated against may come and visit you one day.
Thank you. So we should let our discomfort inspire us. Thank you very much. Ladies and gentlemen, another round of applause for our distinguished panelists. Thank you so much for your time and also for your patience. Lunch is served. Thank you.